How much does it cost? Because I have a friend who, I won't mention his name, but he said he tried it. He said, I decided I cannot afford it. What's the cost?
$45. That's what it was for me.
$45 per
month.
Okay, so you have to weigh.
It's kind of spendy, yeah.
If you buy it in a 3-canister size, you can get a, which is a 3-pack size, you can get a little bit less. It's not quite as costly that way. Save about $5 per canister, but it's still an expensive medication.
It's a factor, isn't it?
Right.
Yeah. What about side effects? I read there are some side effects that are worrisome for some people. How dangerous, in a sense, is it?
Well, the main side effect that people get is about 7% of people, they get irritation of the scalp, which for the most part is not any major problem. We'd stop using the medication, see if it persisted after they restarted it once the irritation had resolved. If it did, then they may just not be a candidate for the use of that treatment modality. Other more serious side effects really haven't been noted, but they are potential because this medication was originally used internally, and there were problems potentially with heart, chest pain, swelling in the legs, swelling and fluid collection in the lungs and around the heart, that sort of thing.
Now those sound serious.
They sound scary, right? Lowering of the blood pressure so people could get dizzy. However, using it topically, you don't get that sort of absorption into your bloodstream, so it really isn't effective. So it doesn't lower the blood pressure, although we monitor to make sure someone is not having that problem, is not getting systemic absorption, because we want to catch it. That would be one of the first signs.
So you have to come in monthly or more often?
Yeah, I'm going back in a couple of days.
Okay.
A person, after they've been on it for 1 month, gets a reevaluation, make sure they're not having any potential side effects. After that, it's about every 6 months to make sure they aren't having any problems, that they're applying it correctly, and also to evaluate the progress of their treatment.
So you need to keep in pretty close touch to your physician. You can't just go to the drugstore and have the blood pressure cuff put on your arm, huh?
It's a prescription medication, and it needs to be filled by your physician. One means by potentially increasing the absorption is to apply the medication on an irritated scalp. So that's one reason you want to make sure that they're not getting irritation. And also, you may get irritation if you got a sunburn. So
stay out of the sun?
Well, just making sure that you take precautions if you're going outside in the sun, just to not get a sunburn. And if you do, just not apply the medicine until your sunburn resolves.
I'm sure people are curious. How long have you been having treatments, and have you seen changes?
I haven't seen a result yet, and I've only been on for just about a month.
Okay, so you're still too early to know.
Got 3 or 4 more months to go until.
Do you find that you get real hopeful thinking about this, and are you afraid that, if I'm in the 3rd that doesn't work, it's going to be a real disappointment? Or
I'm hopeful.
How are you?
I'm very hopeful that it will work for me. But if it doesn't, I don't know. When that day comes.
There are other options, though, aren't there? I mean, one being just saying, well, that's who I am, right?
Well, we'll see what I'm.
But I can imagine, if you're putting this kind of effort and money into it, your hopes really do go up. Do you think that more and more, men and women are going to be trying to do something in terms of restoring hair growth? I mean, is this part of being in the 80s and 90s that we're going to zero in on this more than we have as a society?
Well, I think that appearance is important for a lot of people, and when they start losing their hair, that's an important part of their appearance, and they become more concerned about it and would like to be aware of the various options that are available. and pursue those if they seem interested in whatever technique they decide on, either the medical approach, as Anders has chosen, which right now could keep his hair at the stage it is, or and then until something better comes along, as we were talking, there are other products that are being tried, some that actually block the androgen, which is what causes, which is what the speculation is as far as causing hair loss. If we can actually block the male hormone, the androgen, from getting to the hair and blocking the nutrition, that seems to play a role in the gradual thinning of the hair. That might be very effective. There's been some work on that. As of yet, nothing that we can prescribe, though.
Speaking of nutrition, is there anything, I mean, we look at nutrition with a lot of health problems. Is there anything that you've read or heard about that, in terms of vitamins or nutrients, that we would be well, to take in terms of hair?
Well, a well-balanced diet is important. Taking any more vitamin or protein supplements, for the most part, won't increase hair growth. But it's important to have protein, a good amount of protein in one's diet.
So at least that 11% that we're recommended to have, right? Seems like most Americans get, from what I hear, more protein than we need, but I'm sure some are real low on that too. In terms of stress, I read one study, and we've only got a couple minutes, but I read one study that stress can really affect hair loss.
There are lots of different stresses. Surgery, the body more or less shuts down what it considers non-essential processes in the body, hair growth being one of those, and just a major stress, a death in the family, that sort of thing can also shunt the body's essential mechanisms, so that you don't spend a lot of your energy on the hair growth, but maybe other parts of your body.
So if you have a lot of stress in your life, and you do start losing hair, does that then result in the kind of hair loss that is hard to regain? Or when the stressor is over, let's say you've gotten over the loss, or you've gotten your job, or you've gotten whatever going again, then does that hair come back, or is that like permanent hair loss?
Most of the time, if it's just an acute stress, a major acute stress, your hair is going to regrow. However, if you are a person...
that's good news.
Right. If you are a person whose hair was genetically predetermined to be lost gradually, you may lose it more quickly and then not regain it back because you weren't meant to gain it back again.
So you start the whole process earlier. We have about half a minute left, but I want to give people a phone number, so if they want to learn more about this or just pursue it, they would have a resource. Do you want to just give us sort of your main office number?
Sure. The main office number is 550-1152.
And that's area code 612.
Correct.
Well, maybe we'll have you back in, 6 months, a year, and see how things are going.
Hopefully it's growing then.
Hope it goes well. Yeah. Thank you both so much for joining me. And I've learned a lot. This is one of those topics that you don't know about until you really start thinking. And then there are a lot of psychological and physical connections here. Thank you for being with us. We'll be back again next week. Until then, have a good week.